So, something I hear a lot from veterans, from friends, from family is, well, the doctor told me that I don't have PTSD, or I don't have depression, or I don't have dementia, or whatever. But they didn't actually tell me why I don't, or why I do. Or when I was in the office, I actually didn't understand what they were actually talking about. This is so common, and unfortunately common, that I felt like I needed to make a video about what is a mental health diagnosis. But before we get started, if we haven't met already, my name is Dr. McCleary. I'm a licensed clinical psychologist and a Navy veteran, and I spend the majority of my week assessing and treating active duty service members with PTSD. So, what is a diagnosis? And why is it helpful, or why is it not helpful? So, in general, and simplified down to its smallest level, a mental health diagnosis is just a cluster of symptoms. It's really just a checklist of symptoms to see if you fit into a particular group. And why that's important is for many reasons. But let's stick with what a diagnosis is. Sure, it is a checklist. However, if it was that easy, then you could just be Dr. Google and just Google what a mental health disorder is. And if you feel like you fit in there, then you have the diagnosis. Well, it's not quite that simple, because you can have multiple symptoms that fall into multiple different mental health disorders. You can have multiple mental health disorders at the same time. You can maybe meet criteria for 3 different mental health disorders, but actually just have one mental health disorder. PTSD is a great example of how one diagnosis has multiple symptoms that sound like a lot of other diagnoses. So, for example, in PTSD, you can have difficulty concentrating. And if you have difficulty concentrating, well, that sounds like, maybe some form of dementia. And maybe people think that they have dementia when that concentration issue is actually coming from PTSD. Or people have a sad or depressed mood. Well, that sounds a lot like major depressive disorder. But that sad or depressed mood is related to a trauma that they experienced. Well, that might be a symptom of PTSD and not major depressive disorder. Or it might be both. This is why I went to school for so long, to be able to tell the difference, to be able to assess the nuances, to be able to look at the same symptom and know how it applies to different diagnoses. And this is also why Dr. Google isn't always that helpful. So where did all these diagnoses come from? Did we just make these things up? The short answer is no. We didn't make them up. We didn't make up symptoms like sadness or difficulty sleeping. These things have existed forever. But through science, through statistical analyses over the years, what we have found is that certain clusters of symptoms seem to exist together and cause people distress in a certain format. There's a certain makeup often with a disorder that happens without anybody putting a label on it. It just happens. And we, over the years as scientists, have discovered some of these clusters. And then we put a name to them. Now the name, yeah, we probably made that up. But the actual symptoms, we did not. Nor did we just put a bunch of symptoms together because we liked the way that looked. No. This is how they exist out in nature. This is how they exist out in the world. We've just found out how they exist and put a label to it. But people many times think about, well, why are these labels important? Or are they important? Or are they even detrimental to people? Well, what I'll say, at least starting off, is this. These labels and clusters and diagnoses are important because that's how we study these labels and diagnoses and clusters. And let me say more about that. So once we have found a cluster of symptoms and put a label on it, let's call it PTSD. So now we have something that we can actually study. We can see, well, in what population is this actually affecting people? Okay. But what we can also study and find out is, oh, well, let's see a treatment and develop a treatment for this group of people and see if that works. And over the years, we have discovered multiple evidence-based and scientific-based treatments that work for PTSD. So they work for this group of people that have those clusters or similar clusters set of symptoms. So they have the diagnosis of PTSD, and now we have multiple treatments that we can throw at them. Okay, let's do it again. Major depressive disorder, or depression is what a lot of people just call it. So we developed some treatments for that. Okay, good. All right, well, this works. You try this one. Oh, that one didn't work. All right, let's throw that one in the back. Oh, this one works. Okay. And now we have evidence-based treatments for major depressive disorder. Okay, let's keep going with the science. We have PTSD. Let's bring that group back. Well, we have an evidence-based treatment for depression. Let's see if that works. Doesn't seem to work as well. What about this one? Doesn't seem to work as well. Okay. Well, this is why these labels are important. It's not just to put a label on a person, which I hope that it never comes across like that, even though I know it does sometimes. But we put a label to a diagnosis such as PTSD so we can study and develop treatments for that. Because now I can say, okay, well, you fit this criteria and you fit in this group because of the cluster of symptoms that you have. And I know how to treat it. And I'm not going to particularly treat it, at least first off, with anything that's probably not one of these things that we've already studied that works. Now, are there other things that can potentially help with PTSD or depression? Yes, and we continue to study those things as well. We can also add that, okay, well, let me use both of them. There's 2 evidence-based treatments for PTSD. Well, then, what if I use both of them at the same time? We study all those things as well. So this is why diagnosis is important, because we study it. And this is how we develop treatments. Now I can hear some people saying, well, what if I don't neatly fit in the box of PTSD or another diagnosis? Okay, great question. What if you don't fit criteria for PTSD? A lot of people think that because they don't have all of the checklists for a particular diagnosis, that people are saying when they don't have a diagnosis that, well, they must not be struggling. There is nothing further from the truth. Just because somebody doesn't fit a particular diagnosis does not mean that they are not struggling. That is not what a diagnosis is for. And it's my hope that when I or another clinician says that you don't meet a certain criteria for PTSD or another diagnosis, that it doesn't come across like that. But I know that sometimes it does, which is why I spend so much time telling people not just the results of their assessment or their diagnosis or their lack of diagnosis, but why that is. Receiving a mental health diagnosis or not receiving a mental health diagnosis can be very difficult. So if you do not fully understand why you are receiving whatever diagnosis it is, please ask. And if you are confused or distressed, as many people are during that first appointment when it happens, when you come back next time, please have questions to ask. Or call your physician or your psychologist or therapist or whoever and ask them. Answering that question is part of my job. My job is just not to put a label on somebody, but it's to tell them why and to tell them the work that we've already done to develop treatments to help with what they've got going on. So I encourage you to ask somebody. Ask me. Something to think about. If this video was helpful for you, please like it. Subscribe to my page if you want to learn more about PTSD. But more important than that, if you know someone who is struggling with understanding their mental health diagnosis, I ask that you share this video with them. Because at the end of the day, that's what all of this is really about. One veteran trying to help another.